So my name is Niek van Dijk. I'm an orthopedic surgeon, professor in orthopedics in the University of Amsterdam. I retired from the University of Amsterdam 5 years ago, and currently I'm working in the FIFA Medical Center of Excellence in Spain, in Madrid, and in Porto, and currently also in Pisa. While talking about the latest advancements in orthopedic sports medicine, I think the biggest advancement is that we have gone away from open surgery and now we do much more minimal invasive surgery, arthroscopy, tendoscopy, so treatments for cartilage, treatment for instability, treatment for tendon injuries. Most problems in the hindfoot and in the ankle and the tendons, Achilles tendon, nowadays are treated arthroscopically. So that's, I think, a major advantage because the patient has less pain, has smaller scars, and the rehabilitation is much quicker. So that follows then to a second main advantage in these last years, that is the rehabilitation. And the rehabilitation programs are really more quick, more advanced than in the past, so the patient can go back to his normal activity, his daily activity, his work, his sports, because of quicker rehabilitation. So a lot of treatments are more functional. In the past we did immobilization with a plaster, with a cast, and nowadays we believe more in the natural healing of the body by functional treatments. So that's an advancement. Another advancement of the last years is the treatment of ankle instability, so a patient who gives way, and we have much more knowledge now of the anatomy. It seems strange that we had to require new insight in anatomy, but there have been a lot of research done in the recent years on the anatomy of the ankle, and we now can much more precisely repair the instability, the ligaments, and also again with minimal invasive techniques which have shown to be better than the open repair, also because of the functional rehabilitation. So that's a major advantage. Another advantage, of course, is in the field of treatment of cartilage problems. There's a lot of new ways to treat cartilage problems in the ankle. Yeah, so when we talk about cartilage problems, osteochondral lesions, then some 25 years ago and even longer, we treated with just removing the cartilage, the damaged cartilage, removing the subchondral bone, microfracturing, and then the patient gets new cartilage, fibrocartilage, not the hyaline cartilage. That was, let's say, 25 years ago. Statman from US introduced it, but basically it comes back to maybe 1959, Bridie, who already did this treatment. And then over the last 25 years there has been a lot of research, and the research was directed more towards the biology, towards making new cartilage. But when you look at the evidence, then basically that has not been shown to have better results than this microfracturing. What I'm talking about is the smaller defects. For the larger defects, we always had a problem in the treatment, and nowadays we have this metal implant, this personalized metal implant, which I think is a major advantage because you restore basically the subchondral bone, and the pain in an osteochondral defect doesn't come from the cartilage because the cartilage has no nerve endings. So the pain comes from the bone. So we have been forgetting to treat the bone over the last 25 years, and now we're coming back to treating the bone. And this personalized resurfacing is an excellent method to restore the bone, and in this case not only the bone but also the contour of the cartilage. What I was talking about is this personalized implant for osteochondral defects, so it's local defects, but when you have an arthritic joint, you cannot treat it with a localized implant. You have to treat it either with a prosthesis or with an arthrodesis. Arthrodesis means fixing the bone, so patients are always afraid for an arthrodesis because they believe that they will be incapacitated because there's no joint anymore. So patients always like to have a prosthesis, but in this field there has been made small advances, but not as much as with a hip prosthesis or a knee prosthesis. So the ankle prosthesis is, the patient with an ankle prosthesis, I always say, is not always a happy patient, in the sense that the patient expects to have a normal range of motion, to have no pain, and if they still have a little pain and the motion is not 100%, they are dissatisfied. And a patient with an arthrodesis, he expects that he will still have pain and that he cannot walk, and he will be a happy patient because he has no pain and there's still a lot of motion, not in the ankle joint but in the other joint. So in general, an arthrodesis patient is a happy patient, and a prosthesis patient, ankle prosthesis patient, is an unhappy patient. So in this field there has to be done a lot of research to make those patients with an ankle prosthesis happy.